Hello, my name is Kelly Jiang, and I'm a medical student at the Johns Hopkins School of Medicine.
And I'm Anita Kalluri, also a medical student at Johns Hopkins.
We will be presenting our work titled Comparative Scoping Review of Prenatal Care Resources for Families of Children with Spinal Dysraphism and Hydrocephalus in High-Income Countries and Low- and Middle-Income Countries. We would like to thank our co-authors for their contributions.
Neural tube defects and hydrocephalus are common congenital defects that are major causes of childhood mortality and lifelong disability. Low- and middle-income countries face higher incidences and burdens of care for neural tube defects and hydrocephalus compared to high-income countries, in part due to limited access to neurosurgical intervention. There is limited data describing preventative and surgical management practices in LMICs, and the role of pediatric neurosurgeons here is unclear.
The goal of our study was to conduct a scoping review, integrating studies on prenatal care, counseling, and surgical management for spinal dysraphism and hydrocephalus, focusing on differences in prenatal management practices between LMICs and HICs. We performed a systematic review of electronic databases for English language articles pertaining to care, counseling, and management for families of children with spinal dysraphism and hydrocephalus in LMICs and HICs. A total of 1,259 studies were screened and 70 were included. 62 countries across the world were represented. 12 HICs, highlighted in light blue, and 50 LMICs, highlighted in dark blue, were included.
On thematic analysis, 7 underlying ideas were identified. These were epidemiology and reporting of neural tube defects, folate deficiency and fortification, other risk factors of neural tube defects, prenatal screening, attitudes and perceptions about neural tube defects and their care, neurosurgical management, and recommendations for guideline implementation. Here, we present the key findings from our study. First, the limited number of epidemiological studies demonstrates the need for standardized global neural tube defect surveillance. Next, numerous LMICs have prioritized folate intake in women of childbearing age, but active adherence to supplementation is a limitation that may be overcome through widespread fortification. Likewise, prenatal screening initiatives in LMICs have shown success and may allow for earlier detection and management. Future initiatives and practice guidelines should be designed to reflect the cultures and beliefs of patients in the countries they are implemented in. Finally, neurosurgical management of neural tube defects in LMICs is associated with high rates of complications, morbidity, and mortality.
In conclusion, prenatal counseling and care, as well as folate fortification, are critical in the prevention of spinal dysraphism and hydrocephalus. However, high-quality standardized studies reporting on these issues remain scarce. Pediatric neurosurgeons may be uniquely equipped to address disparities in the care, counseling, and management of families of children with spinal dysraphism and hydrocephalus.